Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Principal Nursing Officer, Terelia Ravalier, National Epidemiologist, Dr. Shaluddin Ahmed, the Chief Environmental Health Officer, Tassie Thomas, Head of the Criminal Investigation Department, Superintendent Davidson Valerie, media partners, listening and viewing public, good evening. As the entire world continues this uphill battle against COVID-19, we here in Dominica, we have made significant strides in our own fight. However, the fight is far from over. And that's why we continue to convene these press briefings, not to scare you, but to inform you. And we'll begin this evening with a presentation by the National Epidemiologist, Dr. Shaluddin Ahmed, who will present some data and an analysis of Dominica's status with regards to COVID-19.
Thank you, Ms. Harry. Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Ministry of Health, Wellness and New Health Investment. Ms. Tassie Thomas, Chief Environmental Health Officer, Acting. Ms. Terelia Ravalier, Principal Nursing Officer, Acting. Superintendent Davidson Valerie, Head of Criminal Investigation Department. And pleasant evening to everyone. As we are all aware, all 16 cases have fully recovered. There are no active cases, and thankfully, we have had no deaths due to COVID-19. Nonetheless, we are not in a position to relax, as all of the confirmed cases were detected through our primary care services, mainly in the La Plaine and Marigot health districts. It is evident that we need to be sure how many symptomatic and asymptomatic cases are out in the community. Hence, our surveillance activities continue. As part of the active surveillance, we have started two activities simultaneously. These are community-based screening and testing of our healthcare workers. Today, I will focus on community-based screening. The main objective of this surveillance is to detect COVID-19 in those with symptoms within the community who are not seeking medical care, as well as those who are asymptomatic roaming around in the community. This process will be conducted by visiting the randomly selected households in the community. All members of the household will be screened for clinical signs and symptoms indicative of COVID-19. This will include temperature checks using a handheld thermometer. This will enable our healthcare team to triage the households before approaching with the rest of the activities. It also includes testing of each member of the selected households. The initial test will be conducted using rapid test kits, and if the result of rapid test is positive, then swab samples will be collected for confirmatory or PCR testing. Subsequently, if the PCR test results is positive, then additional investigation will be carried out as per standard protocol for a confirmed COVID case. The plan is to visit 600 randomly selected households throughout the island. In terms of the sampling design, the Central Statistics Office has provided us with tablets and a list of names and addresses. For that, we have to thank Mrs. Stephens, the chief statisticians, and her team, namely Mr. Dwayne Dick of the Central Statistics Office, who, although on leave, came out to help and provided the much needed support in terms of randomization and collating of the household numbers from their database, and the programming of the tablets for the data collection during the screening process. A tedious process indeed, assisted by his colleague, Ms. Frampton. In terms of the investigation team and its composition, there are a total of 10 teams. Each health district has formed at least one team. Roseau has 3 teams, as they have the largest proportion of households, and Portsmouth has 2 teams. Each team comprises of 4 members. All teams are provided with necessary supplies and documents. Ms. Ghislaine Paul, our logistician, is in touch with the teams and providing all necessary support. I would like to extend the thanks to Mrs. Lambert at the Central Medical Store and Ms. Diane Paul at the Ministry for their support. All health districts are finally on board and ready to conduct the community-based screenings. On that note, I'm happy to announce that the Marigot Health team, led by Dr. Jacob, the St. Joseph Health team, led by Dr. Jajak, and La Plaine Health team, led by Dr. Moses, have started their community-based screening as of today. The teams are very enthusiastic and plan to complete these activities even before their due time. We even have a doctor who is volunteering his time for these screening activities. The actual participants in the community are very receptive and happy for the services that are provided to them. Thus far, the response rate is 100% from these 3 health districts. The information collected on the ground is visible at the central location, provided that Wi-Fi is available on the ground, meaning it is a live feed. So I will be able to assess how it's progressing. In conclusion, I would like to advise the general public that if our health teams visit your house for this screening, please be cooperative and helpful, as this will aid the bringing us back to the state of normalcy in due time. With this, I thank you.
Thank you so much to Dr. Ahmed and all the teams who have been involved in the community testing. Again, like he mentioned, in the Marigot, St. Joseph, and La Plaine Health District, the testing has already begun. And again, the testing is done for those who may not be seeking medical care and for those who may be asymptomatic. At this point, let me urge anyone who may be experiencing symptoms to please contact the Ministry of Health. We understand that there's some fear and anxiety. I'm sure many of you have noticed that people are even afraid to cough in public now. But we ask you that if you are experiencing any symptoms, for us to be able to provide you with the care that you need and for us to continue to curb the spread, to contact the Ministry of Health. Our next presenter this evening is Chief Environmental Health Officer Tassie Thomas.
Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia White Lestrade, National Epidemiologist, Dr. Shalauddin Ahmed, Principal Nursing Officer, Mrs. Terelia Ravalier, Head of Criminal Investigation Department, Superintendent Davidson Valerie, the media partners, the listening public, good evening. The Ministry of Health has reviewed the services offered by the barbers, hairdressers, manicurists and pedicurists, and some category of food service establishments, and have come to the conclusion that with a little monitoring and some guidelines in place, that these businesses can safely open to the public and deliver services. Now the onus is on you, the manager slash owners, and your employees to see to it that the guidelines are safely followed at all times and so as not to put yourselves and your clients at risk. Yes, you are opened. Please don't think that when no one is watching, you can do as you please, because you can be closed for disobeying the protocols as set out by the Ministry of Health. Okay, we have the Environmental Health Department of the Ministry of Health. We have some prepared guidelines, and you may have seen from since Monday, our officers are out there on the field, accessing, visiting these places that we mentioned, like the barbers, hairdressers, pedicurists, manicurists, food places, and so on, handing over the guidelines to them and doing the monitoring throughout the week and so on. So right now, what I would say is that if you have not been visited, if you are among the groups I mentioned and you have not been visited by the environmental health officer, please call the department and request a copy of the guidelines. The guidelines will really tell you what is expected of you. Now, I would just like to highlight a few areas of the guidelines. Social distancing is key, very, very, very important for the employees, the managers, and the clients that you serve. Limited amount of clients at your establishment at any one time. Clients, you should see your clients only by appointment. We don't want people congregating on the outside of your business place awaiting service. Unlike the supermarkets where people form lines and they do the social distancing, it is difficult to establish this kind of thing at a salon or here at a barber shop and this kind of thing, because the process of service is way longer than that of the supermarket. So we are asking that you do not congregate outside these business places. And knowing, those of you who, most of us know these places, how small they are. And then with that, they can only accommodate, on average, probably 2 to 3 persons sitting, taking into consideration social distancing. And therefore, we want these business places, the owners, the managers, to be mindful of that and see to it that you give appointments to your clients. Okay, so you see them by appointment. If you have sitting places for 3-4 persons, fine, you ensure that they are the 1 meter space between each is established as well. Okay, for the employees, some of the things we expect from the employees is that if you're exhibiting any symptoms of the COVID-19 disease, for example, cough, fever, shortness of breath, and other little symptoms of the flu and so on, you do not report to work. You see a doctor. Okay, as well as if you're an employee and you have been away from work as a result of being sick with symptoms of the COVID-19 disease, before reporting to work, you have to obtain clearance from a medical doctor. All employees to wear mask, gloves at any time during servicing of their clients, and they have to limit the face-to-face contact as much as possible. We know this chatty thing, you have to reduce this thing because that too, with that you can also be putting your clients at risk, all the talks and so on, because the proximity of you and the client in these businesses, it's very close. And that's why we ask that both client and employee wear masks at all time. Okay, so all employees to wear their mask, their gloves, and while servicing their clients, Hand sanitizers must be present at all your working stations. And employees, very important, before commencing work, you ensure that your hands are washed with soap and water. For the clients, ensure that your hands are sanitized at the door before entering the establishment. So the onus again is on the manager to see to it that hand sanitizers are present for disinfecting the hands of your clients as they enter your premises. Also, wearing of mask is mandatory. No mask, no service. Okay, so your clients must always wear masks when accessing service from these places. Specifically for the barbers, each client must be draped with a clean cape. These capes, we know they are made of plastic. They can easily be sanitized, easily be cleaned and sanitized. So one will not do. You need to have at least, say, 4 of them, and it depends on the size of your place. So you use one for this client, you are not going to clean it and sanitize it right away to use for somebody else, but then you have another one that is already clean, waiting to be used, and so on. Okay, so everybody must have a clean one for use and not the one used by the previous person before it is washed and sanitized. Okay. Another very important aspect of the business is the cleaning and sanitizing of the surfaces and equipment in your establishment, the chairs, the tables, and everything else inside the establishment has to be cleaned and sanitized before opening to the public. Key is to remove all magazines, books, newspapers from your business. Usually you find in these places, the employers usually put small magazines and booklets and these things to entertain the clients while they wait. This in itself can be a source of contamination, and you cannot have these sitting in the establishment for clients' use whilst you are attending to them. So these have to be removed, all of them. For chairs, when it comes for sanitizing, chairs especially that are made of cloth, you know that this cloth material cannot be sanitized. So by all means, you have to get plastic material to put on these chairs so that these chairs can be easily cleaned and sanitized afterwards. Laundering of linen, towels, and drapes in hot soapy water and dry them thoroughly thereafter. Store all used linen in a tight fitting container. Okay, that in itself will reduce any risk of contamination and that kind of thing. Okay, so what we're saying, you set standards for your establishment. You as a business person, you are not supposed to be disturbed or confused by the guidelines. If you set standards for your clients, they know we are in a pandemic situation. This is what is expected of them. Don't be afraid. They will comply. Okay, so it's for the good of your business. We also have a few guidelines that we have prepared for restaurants, but mostly those that do the takeout services. First of all, I want to inform the public that the food handlers, you must have a valid food handler's permit. Due to COVID-19 and the close contact where food handlers are concerned, we had sort of shelved the normal monthly meeting education sessions with the food handlers. So what we have done as of now is that we are recognizing the social distancing, organizing the place accordingly, and we are giving appointments to food handlers. So if you have someone who is a food handler or whom you are thinking of hiring and the person does not have a food handler's permit, you can call us. We give you an appointment and tell you what time you can come in to have this person certified. So persons must be certified food handlers in order to work in the food establishment. And the social distancing, the wearing of masks, proper hand hygiene, and the same thing goes for these employees as well as the employees in the other establishment. If you are sick, you do not report to work. After sickness, you have to be cleared by a medical doctor before coming back to work. Use of personal protective equipment, very critical, and then allow this space between employees when operating in the food establishment. So with this, let me advise the public that when the environmental health officer comes to you, monitoring what is happening, inspecting your place and so on, it's for your own good, and we are asking that you give us your cooperation and help us to help you in this situation. So with that, I say thank you very much.
And our thanks to the Chief Environmental Health Officer, Tassie Thomas. Of course, their work is extensive, and we're asking that all establishments, again, who are authorized to be open right now, that you adhere to the protocols that have been assigned to you, and you also ensure that your clientele adheres to those protocols. Our next presenter this evening is the Principal Nursing Officer, Terelia Ravalier, and I'm sure many of you have heard that more of our countrymen are back in Dominica, and she will give some details on the quarantine process and facilities.
I recognize the presence of the Honorable Minister of Health, Dr. Irvin McIntyre, Permanent Secretary, Mrs. Wyke, other presenters, chairperson, media, listening public. Good evening to all. I am here to present an update on the government-operated quarantine facilities located in Portsmouth. But before I get into that information, just to let you, the public, know, to date, there have been no effective medicines or vaccines available to treat or prevent COVID-19, which still continues throughout the world. Therefore, we at the Ministry of Health continue with our restrictive public health measures, such as quarantine, along with other measures to reduce the transmission of these deadly virus. Just a brief clarification or reminder to those of you who may have known it already on quarantine and isolation as it relates to COVID-19. Simply put, isolation. It is basically a separation of people who are confirmed cases of COVID-19 from the general public. Here in Dominica, for example, our isolation units are at the Princess Margaret Hospital, which there is a designated isolation unit, as well as there is this COVID unit in St. James, Portsmouth. To date, there are no persons admitted at these facilities, which we call the isolation unit. Whereas, or on the other hand, quarantine, it is the monitoring of people who have no symptoms. But, however, these people may have had contact with people with confirmed or suspected COVID-19. I must indicate that quarantine of persons has played a significant role in controlling the spread of COVID-19. I'm going to move into a brief update on government-operated quarantine facilities. The Ministry of Health, by extension the government, activated its measures to have persons who have been exposed to COVID-19 be quarantined in designated facility located in Portsmouth on the 21st of March 2020. Today gives us 63 days operating these facilities. Permit me to just share again a brief overview of these facilities here in Dominica. That is from the 21st of March to today, 22nd of May. We have had a total of 314 persons have been admitted to the quarantine facility. A total of 237 have been discharged to date. 111 persons from the facilities had nasal swabbing done with no positive results. Also, no persons experienced signs and symptoms of COVID-19 whilst in the quarantine facility. The highest number of staff that we have had as it relates to management includes 14, with 1 data entry personnel as a support staff. The highest number of facilities of building which we had operational at one point is 7 buildings. But to date, there are 4 facilities located presently in Portsmouth. The government, along with the Ministry of Health, have been very compassionate and have therefore considered our very own Dominicans, who are the cruise ship workers who have been at sea for the past few months weathering this COVID-19 pandemic, as well as Dominican students who were studying in Jamaica and were able to make their travel arrangements. These persons were permitted entry to homeland Dominica and were placed in quarantine facilities. That was as of yesterday and today. Therefore, we have a total of 15 students and 33 cruise ship workers. There were already an additional 29 persons already being quarantined. Hence, we have a total of 77 people being quarantined to date. Everyone are settled thus far. The units down in Portsmouth, the quarantine facilities, are manned by capable and competent healthcare providers, especially the senior public health nurse Alexander, Nurse Andrew, Nurse Toussaint, Cuban nurses, the community health aide Roberts and Ms. Brooks, and data entry personnel, Mr. Peters. They are all, I must admit, doing a great job. Support is also given by the Portsmouth Health District team, the district medical officers, the family nurse practitioners, and others. To conclude, I urge the persons in the quarantine facilities, those listening, to continue to comply and work with the staff. Always be respectful to the staff, adhere to the rules and regulations of the facilities, As quarantine, I must say, is not a form of malice, nor is it punitive. Rather, it is a means of protection for the entire public. Thank you.
Thank you very much, Principal Nursing Officer Terelia Ravalier. Let me, on behalf of the Ministry of Health and, of course, by extension, all of Dominica, thank all of those working in the quarantine units. You mentioned a few of them, but of course, the team is a lot more than that. It comprises of a lot more people, including the drivers who are working down there, those who cater for the people in quarantine. I want to thank all of them because your work is not yet done. And every time you see or you hear that more people are coming in, that means your work is starting all over again. So we want to thank you for your dedication to that service. Not everyone can stomach that work, but you have been doing it very well for our own protection. So thank you. And of course, as we head into the weekend, we always like to give a very gentle reminder of what is expected from the general public. And that's why we have with us the head of the Criminal Investigation Department, Superintendent Davidson Valerie.
Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Mrs. Letitia Lestrade-Wyke. National Epidemiologist, Dr. Charlene Lamide. Chief Environmental Health Officer, Tassie Thomas. Principal Nursing Officer, Terelia Ravalier. Members of the listening public, good afternoon. I'm indeed grateful for yet another opportunity to update you on the force's policing plan for COVID-19. The Honorable Prime Minister, during his address to the nation, announced that a number of other businesses were permitted to open. Business owners are reminded to strictly comply with the conditions stipulated for reopening. All bars are to remain closed. There were no changes in the curfew hours. Therefore, the curfew hours remain as 7 p.m. to 5 a.m. Monday to Saturday. The lockdown weekend commences from 6 p.m. on Saturday, May 23rd, 2020, until 5 a.m. Monday, May 25th, 2020. I want to remind the general public that during the curfew period, access will only be permitted to essential service providers or individuals who have permission from the Commissioner of Police. Access to the rivers and beaches will continue during the period Monday to Saturday from 8 a.m. to 5 p.m. Groups of 10 persons or less will be permitted to access the beaches or rivers. You are reminded that no parties, barbecues, or consumption of alcohol on the beaches or rivers will be permitted. Physical distancing must be maintained while on the beach or at the river, and any police officer of the Commonwealth of Dominica Police Force reserves the right to deny access to the beach or to prevent persons from the rivers if the curfew orders are being breached. So far, there has been no known violation of these conditions in relation to the breach in relation to the beach or the rivers. However, anyone found in violation of the conditions for utilizing the beaches or the rivers will be prosecuted. Ladies and gentlemen, I again want to implore you to follow all protocols issued by the Ministry of Health. In closing, I want to thank the rank and file of the Commonwealth of Dominica Police Force for their continued effort in performing their duties. I also want to thank the various departments, agencies, and businesses who continue to partner with the Commonwealth of Dominica Police Force in this fight. Together, we will succeed. I thank you.
And again, our deepest gratitude to Superintendent Davidson Valerie for taking some time to speak with us. And of course, to all of his colleagues who continue to work very hard, especially on the weekends. I would like to again ask the general public to comply. You know that old saying that if it's not broken, then why fix it? The protocols have worked for us so far. We are down to 0 positive cases in Dominica. That means that whatever you've been doing, whatever the ministry has been doing, whatever the government has been doing, has been working. But now is not the time to become complacent. Now it is even more important for us to be vigilant. As Dr. Ahmed says, the community testing will look for asymptomatic individuals. Treat everyone as a suspect because you're not sure. And if we continue to adhere to the protocols, continue to exercise all the practices, the hand washing, the respiratory etiquette, the sanitization and disinfection, if we continue to do those things, we will find ourselves in an even better position. Again, we thank all those who so far have complied. We thank those who have marshaled and who have supported the efforts of all of the officials. And again, we thank you for tuning in and for your patience. And we thank all the businesses as well who have adhered to the protocols. We know it's not easy. It's not an easy time. But together, if we do what we're supposed to do, we'll all make it through. Thank you, everyone, and have a good evening.